Okay. So, welcome to today's webinar entitled Food Safe and School Ready Tips for Allergies, EoE, and Celiac. This is co-hosted and sponsored by the Weill Cornell Medicine Division of Pediatric Gastroenterology, Division of Pediatric Allergy and Immunology, as well as the FATE Food Allergy and Intolerance Support Program that we offer here through the Division of Gastroenterology. We welcome everyone's participation today, and we hope to provide you with some significant information of how to get ready for school. I'd like to introduce our presenters tonight. I'm Eliza Solomon from the Division of Pediatric Gastroenterology. I will be presenting as well as moderating throughout the session. I have Dr. Pradita Permal, who serves as the Director of the Division of Pediatric Allergy and Immunology, Dr. Ariel Bergman, who is my co-conspirator for the FATE division and is also a member of the Gastroenterology department. We have Ayelet Goldhaber, who's a registered dietitian, presenting on behalf of the food allergy group, as well as Liza Goldberg, one of the social workers here at Cornell. Just a disclaimer that this is a webinar. Information that we will present is not intended to replace or as a substitution for medical professionals who are actually treating your child or family member. Please seek out any kind of specific information from your medical provider. We also ask that if you are going to submit a question into the Q&A section, it be generalizable to the entire population rather than asking individual questions pertaining to a specific child or clinical scenario. So today we're going to go through a bunch of topics. First of all, just identifying the difference between a food allergy, specifically that's antibody-mediated, eosinophilic esophagitis, and celiac disease. Then what do you need to think about depending on what age your child is? Is it a preschool child? Is it a school-age child? Or is it an adolescent or teen or even young adult going off to college that we really need to think about how to address and how to be prepared for school? So the first thing is, what is the difference between these disorders? I'm going to turn it over to Dr. Permal to start us off.
Hi, everyone. So I'm going to be talking a little bit about food allergy, and it's very important to make the distinction between a food allergy and a food intolerance. So when we talk about food allergy, we're talking about an IgE-mediated phenomenon, and we'll talk a little bit about what that is as well. But the definition is an adverse health effect arising from a specific immune response that occurs reproducibly, that is very important, on exposure to a given food, and it can result in a potentially life-threatening allergic reaction. What is a food allergen? A food allergen is a specific component of food or ingredient within food, typically protein, that is recognized by allergen-specific immune cells, and that is the IgE molecule. So when we see a patient in our allergy clinic, we're going to do either skin testing, skin prick testing, or specific IgE testing, which is blood work. And what we're measuring basically is IgE antibodies to a particular food allergen. And you can see here on the lower left, we have extracts, vials that contain the actual allergen. And then in the middle, these are the lancets that we use to skin prick test with. And then here you can see a positive reaction. So we measure what's called a wheal and flare, the raised part, and then you can see the redness around it. What we worry about, and I did say it could be a potentially life-threatening reaction, is anaphylaxis. And anaphylaxis, by definition, is a serious allergic reaction that is rapid in onset and may cause death. And it can occur from minutes to up to 1 to 2 hours, but usually pretty quick within the first 15 minutes after allergen exposure. It usually involves two or more major organ systems, as you can see on the right with the pictures. So the symptoms can be varied, but oftentimes we'll see hives, itching, swelling of the lips, tongue, worst case scenario, throat. And then we have respiratory symptoms, repetitive coughing, difficulty breathing, wheezing. We can have gastrointestinal symptoms such as abdominal pain, vomiting, diarrhea that can all happen pretty quickly. And then cardiovascular is the worst case scenario where we have hypotension, they become lethargic, loss of consciousness, and that's why we need to give the epinephrine. If you want to click again. Yes, we want to carry always an EpiPen. If you have a food allergy, you should always, always have an EpiPen or epinephrine autoinjector on your person. And that is your life-saving measure. That's it.
Thank you so much for that definition. And it is crucial that we understand that those allergies, again, have the potential to be life-threatening. On the other hand, some people have allergies that are isolated in specific areas. So eosinophilic esophagitis, or EoE, is also a chronic immune allergic condition, but unlike the allergies just described, they are mediated or they are triggered not through an antibody type reaction. So they are more in the cells. You can have some symptoms that sound similar, but it is not an immediate type reaction. So you don't develop symptoms on exposure immediately within a short time frame to a food or another type of trigger. It is more long-standing, could be days, could be weeks, where symptoms that develop are primarily resulting from inflammation in the esophagus, which is your food pipe. Depending on the age of the person involved, it can be not wanting to eat, feeling difficulty when you swallow, feeling food going down slowly or getting stuck. In a young child, that might be they need to take sips of water after each swallow. It could also present in older patients with vomiting, chest burn, or classic heartburn type complaints, as well as sometimes nonspecific airway things. So when we hear about someone who just has a chronic cough, or maybe they have a lot of saliva building up, that's because things aren't going down as quickly as we anticipate. They are not classic, but the airway type symptoms, more the gastrointestinal symptoms, are more classic. But again, this is an allergic phenomenon. People who are predisposed may also have other allergies. So the classic allergies we just talked about to foods, it could also be to the environment with what we call allergic rhinitis, the runny nose, itchy eyes. They may also have eczema or asthma. This condition can run in families, and there's a variety of treatments out there. Some of them include diet elimination, but alternatively, there are medication options for treatment, which include a medication called a proton pump inhibitor. You may have heard of omeprazole or lansoprazole or esomeprazole. Those have been used. Swallowed topical steroids, which is a budesonide that is mixed and swallowed or delivered slowly into the esophagus to coat it. Or a newer drug called dupilumab, which is an injectable drug. We do know that if you do not treat this condition, it is progressive. And if you can see in the images, a normal esophagus has the interior, which is open, so food can go down. It's very smooth. And as the inflammation continues and progresses, it becomes more scarred, narrower, with the idea of fibrosis, which is scar tissue and doesn't allow the food to actually pass. Dr. Bergman?
Thank you. So moving on to celiac disease. So celiac disease is a separate entity, not allergic related, but does involve elimination of certain foods, which is why we have this all lumped together. So what is it exactly? It's an immune-mediated enteropathy, meaning that there's these antibodies, which are usually supposed to be good for us and fight off viruses and bacteria, various infections. But in people who have celiac disease, these antibodies come in the presence of gluten, which is a protein found in wheat, barley, and rye. So that leads to inflammation in the small intestine. This happens specifically in genetic susceptible individuals. So you need certain genes to be able to get it. Not everyone that has these genes will get celiac disease. And then you can get various symptoms with celiac disease. So classically, you may hear of patients who came in because they had abdominal pain, constipation or diarrhea, problems gaining weight or losing weight, bloating. There's also less classical atypical complaints such as short stature, delayed puberty, various types of specific rashes. And you can even have zero symptoms and have celiac disease, which often surprises many people because we even diagnose this in patients who we perform screening on because they have a first degree family member with the condition, and so they need to get screening, and they find out they have celiac disease even though they had no symptoms. And there's other conditions as well that would prompt screening. And as mentioned, the only way to treat this is through diet. So strict gluten-free diet, specifically gluten is found in wheat, barley, and rye. So we have to be extremely careful in avoiding these foods. Eating these foods will continue to expose our small intestine to these antibodies of celiac disease and continue to cause inflammation, which can lead not only to these symptoms, but vitamin deficiencies as well. And so in this picture here, it's showing in the small intestine, which is in the middle part here. Usually we have these nice villi, which are finger-like projections in the small intestine that are there to help absorb nutrients. But in celiac disease, they're completely blunted, so they become flat. But reassuringly, when you do go on a gluten-free diet, the goal is that they return back to their previous state.
Thanks for that. So you can see that uniformly, these are three different entities with some commonality when it comes to food or food exposures. So, Dr. Parmal, what do we need to think about outside the home?
So I think first and foremost, you definitely should have a good understanding of your child's food allergy or food intolerance. Understand what could happen if they were to eat the food that we should be avoiding. Also, I think definitely getting in touch with the school and being clear on the school's guidelines for managing a food allergy or a food intolerance, advocating for your child. Communicating with the school nurse, particularly for our food allergy patients. We provide an anaphylaxis management plan along with medications, prescription for epinephrine autoinjectors and oral antihistamines. And we go over in great detail with the parents and also with the school nurse, how to treat an anaphylactic reaction should that occur at school. I always tell families to teach your child, if they're old enough, how to advocate for themselves, how to ask questions, what's in that meal, what's in that food, to never, ever, ever share food at school, and always have an open line of communication because there can be episodes of food bullying. This has happened, food allergy bullying. We've had this happen in classrooms and in schools. And so children should be able to come home and say what's happening at school, and then having an open line of communication with also the teachers and everyone else at school. Learning positive coping skills is very important. Recognize and manage mental health issues due to any chronic illness is important, but particularly when we're talking about food allergy and intolerances. Trusting your physicians, your dietitians, and always being prepared for situations as they arise. That's it.
Thank you so much. So as we move on, the next topic is, okay, so we understand what our conditions are, and what about my child going to preschool? Is there something that I need to be aware of? Should I be asking? What do I need to do moving forward? I'll turn it over to our dietitian, Ayala.
Thank you. So before school starts, we absolutely want to connect with our school staff and discuss what we need to discuss before we get our kiddo in the classroom. It might be a staff member, it might be a member of administration, it might be the class teacher, it might be the school nurse or social worker. But we want to establish these lines of communication before the first day of school. We want to talk about what the plan is for lunch and snacks. Will it be a packed lunch? Will there be a lunch provided? If so, does it meet the criteria for your child's requirements? Is it free of all of their allergens and their intolerances? Or is it better that we provide a packed lunch? And if that's the case, what is going to be the protocol? Is there a refrigerator available? Is there a microwave that's safe to use? Or is there going to be a combination? So perhaps it means getting the school menu ahead of time to decide which days might be packed days versus school lunch days. We also want to know what's happening in the classroom before it happens. We want to know if there are cultural celebrations or holidays that are going to be happening. Very often, food plays a role in the lesson plan relating to a holiday or a special day. And so we want that information from the teacher or the head of the grade before these happen so that we can be prepared with appropriate alternatives. And we want to know if there will be activities involving food that might be risky for our kids. Maybe it's baking. Maybe it's playing with Play-Doh that contains some wheat starch. Maybe it's a sensory bin that has food items in it. Maybe apples in the fall or pumpkins near Halloween. We want to know what those food items will be so that we can be prepared. Very often and very classic, we have our pasta necklaces and pasta picture frames that come home, and it's really sweet and adorable, but really risky for certain kids. And so we want to make that really clear to the teacher, again, before school starts and before the lesson is planned. Also helpful to build a stash at school. This means having a sealed container with your child's name on it that has items that can be kind of like buffers or fill-ins with easy access. So it might be extra snacks, extra items for lunches, for class trips, for birthday parties, if there's a reward system in place involving food. This way, the teacher has easy access to foods that we know are particularly safe for our children. It might be little bags of pretzels, cookies, granola bars, drink boxes, rice cakes, dried fruit. You and your child and your dietitian can work together to figure out how to fill out this box to make sure that it's ready at school before school starts. Some common sources of contamination, just so we're extra cautious. And this might be helpful to share with administration or with the teacher so that it can jog their memory for food items that might be in the lesson plan already. The art projects that contain food, the jewelry projects, anything that has a grain or a bean or a macaroni, anything that sounds like an alarm bell for your child. Very often, schools will collect food cartons for projects or for charity opportunities. We want to be really cautious that our kids with sensitivities or allergies are not handling those items. For example, an egg carton could easily have egg on it. A cream cheese container would have a source of dairy on it. So we want to be careful that kids are not manipulating these materials. And like we talked about, the sensory bins, your teachers might not know about a legume allergy or a fruit allergy. So corns, peas, rice, beans, grains, all of these should be reviewed. We talked about Play-Doh. And of course, birthday parties outside of school. It might be helpful for the teacher or the class representative or a class parent to discuss with the parents in the class regarding future birthday parties outside the classroom so that everybody can be involved.
Thank you so much. That was very interesting, thinking about these things that you may not come to mind because you're not thinking about them eating the actual food. Liza, there are some other things you can put in play in the classroom so that way we can protect ourselves, right?
Yes, so I'm going to be speaking about a 504 plan, and it's another way to be prepared when your child is heading off to school. So essentially, what is a 504 plan? And it's a school-based plan that ensures that students with disabilities or chronic health conditions have equal access to education. It's based on the Section 504 of the Rehabilitation Act of 1973, which is a federal civil rights law that protects against discrimination. With that being said, who qualifies for a 504? So any student that has a physical or mental health condition that substantially limits one or more major life activity, for example, learning, concentrating, breathing, eating, walking, and the condition can be chronic or even, long-term or temporary, but it has to impact school functioning. it differentiates from an IEP, which is an individualized education plan, because the 504 plan is for students that can learn in a regular classroom environment but need accommodations in doing so, whereas an individualized education plan is for students that need specialized education. When we're thinking about like preschool age students, not everyone goes to public school. So it's important to note that a 504 is for any school program that's federally funded. So if you're going to, for example, a private school, they don't have to abide by a 504 plan, but they will still likely, set up an accommodations for your child that is a similar, outline or layout to what a 504 plan looks like. And essentially, it does not change the curriculum, but it removes barriers to learning. So for the conditions that we're speaking about, celiac, EoE, IG-mediated food allergies, that would all fall under criteria that you'd be entitled to a 504. And, when thinking about being prepared for going to school, it's important to connect with, your doctor's office, myself, and we can help you, have the right paperwork in place. Also for New York City schools, they have their own like documentation that, we would work on with you and, fill out. In addition, we would also provide a detailed letter advocating for your child's needs. If your child goes to, a private school, we can also help advocate because, under the ADA, your child would be, likely to receive accommodations where these conditions would fall under that. So we can work together to come up with a plan and help advocate with the school. When we're thinking about the preschool age, the focus really becomes on health, safety, and participation in daily routines. Obviously, this age group, they're not as independent, and the supports are, simple and focused on the care needs and inclusion. And it's a lot of advocating, for your child with the help of, your providers and with the school directly and probably the teacher. So it's really important to have, a plan in place, understand, for example, with like food safety, gluten-free, allergen-free meals and snacks in place. Some accommodations that, we work on is, for example, having, either the school would provide, gluten-free meals if your child is getting food from the school. If they can't, then the school would have to allow you to bring your own food and snacks in that are safe. Really, it's a lot around education. What are these conditions? What, preventing cross-contamination in classroom and cafeterias. As other people mentioned, having the staff trained to recognize reaction, developing a relationship with the school nurse, having a written action plan in place, for a lot of these conditions, unlimited or immediate bathroom access. And the whole goal is to really make sure that, your child is included and can learn without, their condition becoming a barrier for them. And then also, I think it's important to just talk about, when speaking with your kid who's, in school at this age range, kind of understanding, help normalize their differences using simple statements like everybody has things that help them stay healthy, teaching them how to advocate for themselves, even though they're very young, using simple words like some foods can make my body sick, even thinking about like imaginary play through, you can play like restaurant and thinking about, if your child, for example, has celiac, they can play like asking, hi, is this food gluten-free, or, things like that. And then also just thinking about like a lot of our social lives, and their social lives at school may involve food or classroom parties and things like that. So always being prepared so that your child doesn't have to be excluded. So, for example, if there's a birthday party in school, having advance notice on that, and so that your child can have a safe food for them so that they can participate.
So these are all really important things, even to think about at such a young age. So thank you both for introducing a lot of that. So our kids are older now, they're school age, they're able to verbalize more. What do we need to do for them when it comes to school and school safe day?
Yes. So when, for example, in an elementary school, it might, a 504 plan, I think also I should mention that a 504 plan is not static. It changes with your child's needs. So when you're looking at, preschool to then elementary school and then, further into middle school and high school, it's going to look different in terms of what accommodations we need to put in place to advocate for your child. In elementary school, the focus really becomes on access to learning, classroom routines. At this age, generally, students are still very dependent on teachers. So when we think of like supports in place, it's more teacher directed. And examples of that might be, flexible seating, permission to have snacks and water or food, from home. In elementary school as well, extra time on tests or assignments. If they need a modified attendance schedule, we can put that in place. And it's really on building a communication system between parents and teacher for health updates. And then also just in general, when thinking about like being prepared for events, within the school and school trips, things like that.
Yeah, I think one of the things on the bottom of your slide is the importance of staff-parent communication about anything food related. Because it's true, we as parents really would like to know what's going on because as we worry when we're not there, we want to know and be assured that someone in the school or in the classroom is monitoring for these things that we're fearing. So it's really important. What about the psychosocial aspect? What do we need to think about there?
Exactly. So I think at this, at any age, right, of course, but when thinking about elementary school children, maybe they, have a medical condition and then they're worried about feeling different or, I think as someone mentioned before about being teased or exclusion or just embarrassment, right? So it's really important to teach your kid how to advocate for themselves, for example, by saying some foods make my body feel sick, but then also learning that, that they should always check with an adult first, especially at this age where we're starting to teach label reading, but they might not be proficient in that, right? So always having a safe adult usually would be probably the teacher, and maybe, if there's an assistant teacher, kind of helping them understand how their body works, what's best for them, helping them understand, yes, they are different, but their condition doesn't define them or exclude them in any way. And I think that's a lot about also practicing like refusal skills, and, if they need extra support, really, having books that are age appropriate that can discuss some of these things as well.
Ayala, now that they're school age, what are things do we have to think about for this age group?
Great. So again, we're going to focus on what to do before school starts because that is such an important part of the whole picture. At this age, we really want to work together with our kids. This really separates the older kids from the younger kids. We're really moving past the passive part and really working towards engagement with little ones, even as early as school age. We want their buy-in, but we also want them to become familiar with the questions and the work that we're doing to set the foundation for when they're ready to do it on their own. So we want to involve our kids in planning a lunchbox rotation, identifying the snacks for school, for the bus, for after school, so that they are involved and aware and in a lot of ways approve of the snacks or the lunches that we'll be packing. It might mean that before school starts, going grocery shopping together, finding the right lunchbox together, deciding which pocket of the backpack it will go in. These types of plans will make everything easier as we begin school. We begin packing our lunch boxes and our backpacks each night to make school a bit smoother. We want to make sure that we're setting our kids up to feel well nourished. We know that well-nourished bodies learn better and cope better. And so we want to make sure that despite any sensitivities or allergies, we're still giving opportunities for protein, for carbohydrate, for fruit and vegetables, and plenty of hydration during the school day. We want our kids with backpacks to always carry something extra. It might be an extra long ride on the bus in traffic or going home with a friend. And we want to make sure that they have something available to them no matter what. And so we encourage leaving an extra snack in the backpack and also at school and in a place that they can access easily. We want to think about all parts of the day when food is involved. It doesn't just stop when we leave the classroom, but our way home, the bus ride home or the carpool home, we want kids to understand the importance of keeping their own snack, avoiding swapping and sharing with other kids that can lead to cross-contamination or accidentally getting a hold of a food that they're not supposed to be having. And as kids start reading, maybe we start in first, second, third grade, just looking for certain words to identify on the food label that they can practice identifying. And it's nice to involve them in their reading level, in their, if there's a picture on the label, a gluten-free label, for example. These are nice ways to start the process of reading food labels even before kids are fully reading. And again, we want to plan for the whole day. So we want to make sure that when they get home from school, we're also continuing to nourish them appropriately. So planning an after-school snack with a bit of extra protein, especially if lunch wasn't such a success. And we want to know that kids will come home hungry and that they'll have a snack ready for them. And so reviewing this with your child before school starts is a nice way to get them involved. So in terms of our older kids in school, we want to think about their new sources of contamination now that they're a bit older. So science experiments start around this age, very often involving certain foods, especially eggs or milk that might be used in the science room or really any classrooms. We want to make sure that teachers are aware. Class trips will start in this age group, very often with boxed lunches or alternative lunches, something different from their typical school day. So we want to know about this ahead of time so that we can prepare accordingly. After school clubs, after school sports, where snacks might be provided. Again, we want to know, is this an opportunity to pack a snack or is something going to be provided that will be safe? And many schools in the lunchroom start a buffet style around this age. And so we're no longer serving the kids in the cafeteria, but they may be walking up to a salad bar, a soup bar, a pasta bar. They may be going to the main food area alone. We want to make sure that they're prepared and know how to handle that. And it might be the beginning of venturing out on their own, maybe to a friend's house, maybe a quick walk across the street to a coffee shop. And these are things we can practice with our kids before school starts so that they can identify safe foods on the menu. Always good, even as kids get older, to have a point person in school so that they know to go directly to them with questions. Maybe that person can call you easily or text you easily, have a direct line to the parents, so that kids are still supported even as they continue to get older.
All right, so we've made it through this. Now we come to the teenage or the adolescence. Yell it. What's a little different here?
Yeah, so our kids are getting older, and so we need them to practice. All of these foundations that have been put in place from school age to preschool age to school age, these are all forms of practice that have been set for them. They've watched us ask the questions, and now it's time for them to practice asking the questions. So as school starts, you would want them to pretend that they were in the restaurant, ask you the questions, pretend or do a little bit of role play so they know how to say no to unsafe foods. Practice reading food labels so that when they're out with their friends, they can do it on their own. Identify the food claims that are relevant to their diet. It might be a gluten-free label. It might be something that says contains dairy or made in a facility that contains dairy. You want to go through all of these scenarios with them so that they're prepared to do it on their own. Additionally, we've helped them along the way, and now it is really their turn to identify forms of cross-contamination in the lunchroom and the classroom and talk through with you what some options are instead. Finding menus online. All of our kids are starting to have cell phones around this age. So we want to utilize it for good, and help them access menus for restaurants, help them access the correct websites or the correct apps, to help identify safe foods, and to look at their lunch menus ahead of time to make sure that they have an option. And we still want to nourish our kids even in their teenage years because they're still learning and still developing and still very much growing. And so continuing to make sure we provide adequate protein and fiber, and overall nutrition and hydration to keep them going, is still very relevant in these years. I also really encourage routine around meal and snack time. This helps again to create the scenario for practice. So the more routine and schedule we have around mealtime and snack time, the more familiar it becomes and the more independent the child can become when it comes to planning their own meals and snacks in the future.
I think one of the things that we struggle with in this age group is that need for independence by the teenagers, right? They want to be more independent. They want to be making their own choices. But I do think having an open conversation relationship with your providers and your medical team is crucial to understand risk benefit of some of these things.
Yeah.
Liza.
Yes, exactly what you're saying is, a 504 plan in middle school will look a little bit different than it does in elementary school. When we're talking about accommodations in the middle school setting, when it comes to food or, gluten-free, allergen-free, food at school, in school meals, in the cafeteria, or in the classroom, that would be the same, right? And same for, alternatives when you're talking about class activities or field trips, and same with medical management. But when you're talking about the middle school age, it's, as everyone mentioned before, it's a time of increased independence. Your child is navigating not only their condition, but also multiple classes. They're usually switching between different classes throughout the day, different teachers, right? So you want to make sure that the 504 plan is in place and it remains consistent throughout the school day, and that the plan for them is consistent with, each class that they're in. Also, when we're thinking about academic support with this age group, we're talking about extended time on tests. For example, if their symptoms are interrupting, testing, or depending on symptoms, maybe modified gym participation, excused absences related to their condition or medical appointments, if they're to need access to notes because they missed class, things like that, they should have access to that. Essentially, you don't want your child to be penalized for missing any school because of, their medical conditions. So you want to have this plan in place just so that each time, for example, your child is out or your child needs to use the bathroom, right, they're able to without having to explain themselves. I know in many middle schools and high schools, the school will lock the bathrooms and kids can only use it at a certain time. So it's really important that they have that plan in place so that they don't have to ask for permission, and it's just something that the school and all their different teachers know that they can do. It also helps with, not having your child feel singled out or different or, weird in any way because of their condition, right? And I think, again, as people said before, it's a lot about practicing, with your child, that they can advocate for themselves, and understand that this is a time where peer pressure does increase, right, for better or worse, with this age group, right? And so your child will likely have to navigate, peer pressure, and what does that look like? And I think, we need to understand, right, that first have your child, make sure your child understands their condition, right? Can they talk about it? Can they explain it in their own words? and really get to know that and make sure that they're confident in that. And then also practicing simple scripts that they can say, for example, with peers, if they're eating in the cafeteria and somebody wants to swap food, or if they're going out and they're going to a restaurant with their friends, right? Either having a plan in place and understanding what their options are beforehand, or if it's food swapping, practicing with your child, a sentence as simple as "thanks for offering that, but I have my own safe food." And really normalizing saying no, which can be hard with this age group, but you kind of working on reframing that the refusal as a strength, not a weakness, right? And so the emphasis on taking care of yourself, rather than fitting in the moment. And this, will develop over time. Your child will be more comfortable with this over time. I think, also if your child has had their condition from, when they're very young versus, if they develop it at a later point, these are things that can be addressed, throughout or as they're diagnosed, right? And then it's important to address peer pressure directly, right? So talking about situations where that might come up, birthday parties, out socializing with your friends at a friend's house, brainstorming ideas ahead of time of how they can respond. And as people mentioned before, encouraging them to carry like safe alternative food options, just so that they don't ever feel left out. And then, you want to empower them to gradually become more independent. So advocating for them to, whether they're at school and needing to ask, the person in the lunchroom if the food is cross-contaminated, or, if they're on a field trip at school and they need to understand what their options are, that they have their voice and that they're able to speak for themselves is really important. And then just one key takeaway is that, they should understand that their health is non-negotiable, and speaking up protects them. And I think that's just something that as providers we can reinforce, as parents you can reinforce, and it will help kids at any age level over the long run. Okay.
Are there any big differences with the high schoolers, or it's kind of a similar?
I think with high school, it's pretty similar, right? Because in terms of the accommodations in place, right? And again, when it comes to your child, usually with each school year, we have to renew 504 accommodations. So, touch base with us. We could, talk about where they're at, what their needs are, and put that in place. Sometimes in college, in high school, you're thinking about college, so you're thinking about like SAT or ACT accommodations, or maybe more flexibility for absences. Maybe that will have a greater impact if you're missing more valuable like learning class time. And so high school, middle school, it's more focused on academic accommodations, just because you're where you're at in terms of learning and all of that valuable time. But overall, yeah.
About that. And then, of course, how it affects us socially.
Yeah, I think it's similar to the middle school age, right? We're talking, in high school, high school age students want to be, they're becoming more independent. Usually they already understand what they can and can't consume. Obviously, if they're diagnosed with a condition in high school, then that will be, a learning curve, but they do have more independence, right, than younger children. So sometimes, we could see someone developing like maybe anxiety around social events or eating, and just because they have more awareness into what they should and shouldn't have, right? And so it's managing that. A lot of that again is talking with your child, talking with having your child talk with their provider, really addressing head on what their concerns are, what, their fears are, supporting them in terms of, yes, like if your child's feeling different or excluded, and then helping them understand what alternatives are available to them. And I think, the good thing with, for example, in New York City, there's so many gluten-free, allergy-friendly options, even in restaurants or like our day-to-day. So helping your child like identify where that might be. Obviously in school, again, it's all about being prepared, and helping them just become really like their own advocate is the main goal, I would say.
So I think overall, in conclusion, what we hope that you took out from this webinar is that food-related disorders can vary as far as what the specific one is, but they have a lot of commonality when it comes to how it affects our children's daily lives. And these considerations should really be made to address the issues that come up in the educational environment, in their social environment, so within the school day, but all aspects of it, leading up to it, actual school day, post-school day, and how they're acting with their teachers, their friends, their nurses there. But know that you are definitely not alone. There are resources out there from your medical team, from the your providers, your ancillary providers. Obviously, dietitians and social work are crucial in these kind of scenarios. So I'd love to see if there's any questions from the audience in a Q&A, and I'm going to start off by asking Dr. Parmal a question. Often in these teenagers or as they become older, they want to be independent. They feel sometimes that nothing can touch them. They don't want to carry their EpiPen with them. Do you have any tricks or advice when this scenario comes up?
Yes, we have this conversation come up very often in our clinic, especially our kids who are going off to college. They're going to be going out to eat, going to be partying. Are they going to carry their EpiPen? We have the conversation. It's a little bit easier if they've already had an anaphylactic reaction and they know what that's like. I find that the kids who have had anaphylaxis occur are a little bit more, they're going to carry their EpiPens because they don't want that to happen again. It's the ones who have not had an anaphylactic reaction and don't really know what that entails. The fortunate thing is now we're in a time period where we have great therapies now that are on the horizon. And one of those therapies is Xolair. You might have heard of that. It's an anti-IgE monoclonal antibody. It's a shot. It is an injection. You do have to take it every 2 weeks, but the studies have shown that if you give this medication, it can prevent, in the far majority of kids, anaphylaxis. So for the kids who are a little bit more, risk-taking, we always pose that as an option. And then the other treatment that we have now on the horizon is oral immunotherapy, where we're basically feeding small amounts of the food allergen to desensitize the body. But this all has to be done under the supervision of an allergist. So we're making headway with this problem, but yes, we have to have this conversation very often with the kids and just explain to them what actually can happen if you don't carry your EpiPen and if you don't, watch what you're eating and taking precautions and all the things that we've talked about today.
Thank you. Ayala, question for you. These teenagers that love to eat out but may not have immediate type reactions, what are the good tips that you can advise them or really counsel them on why they shouldn't be maybe taking risk behaviors?
Yeah, so this is really going to depend on whether there's an IgE-mediated allergy, celiac, or sensitivity. We treat this slightly differently. But in all cases, cross-contamination continues to be a real source of contamination or exposure. So there are some practical tips. And then, of course, weighing the risks and benefits with your care team is really important as well. Some tips: changing gloves. Your food care handler should always change their gloves. when they're handling your food, making sure that you have a menu handy. For example, the franchise restaurants all have menus online. Having that screenshotted on your phone before you walk into a restaurant, or identifying if it's a restaurant that has options for you. Asking the right questions. We talk about French fries a lot. French fries, for example, in celiac disease are gluten-free in theory, but very often contaminated in the oil that they're fried with. So certainly depending on the food we're avoiding, we can talk about some strategies. And we also have strategies to avoid these scenarios altogether. So for example, eating before you go out to eat is really helpful so that you can just go and socialize rather than having to be hungry and worrying about what to order. Bringing a snack with you so that you can kind of snack in a restaurant rather than having to order a main course if it feels too risky. And certainly practicing the right questions to ask and feeling confident in asking those questions. And it might be that we have a kid who maybe doesn't feel confident, and that's okay for them. And it's okay to skip those types of activities too.
Liza, the question for you is for celiac, but this can be for any of the disorders. If you have a very responsive school and teachers, do you need to have, is it mandatory? Is it recommended that you have a 504 anyway?
Yeah, so that question comes up a lot. And basically, it's not mandatory, but it is recommended. So we want to think of a 504 sort of like an insurance policy. Hopefully, you don't have to tap into it, but for whatever reason, should something change with your child's symptoms, or, let's say your child has this amazing teacher and the school's very responsive, but the teacher switches halfway, through the year, things happen, right? So it's important to just have a 504 in place, especially because your child is entitled to the accommodations. And so you don't want to have a situation happen and then have to, sort of put out the fire. You just want it to be in place and be able to access it or tap into it should you need to.
All right, I'm going to throw this out to anyone who wants to answer. Halloween is coming up. Trick-or-treating is coming up. How do we manage? What are any tips for trick or treat, candy collection? What should we think about?
So I'll jump on this. Our program has been involved in the Teal Pumpkin Project, which has been around for a few years and is really excitedly gaining popularity. In fact, CBS just partnered with them last year as well, which is really exciting. And this program encourages families to use a teal colored pumpkin as a symbol of non-food related prizes or treats that can be handed out. So you might choose to put a teal pumpkin outside your doorway, maybe with a little explanation. You might hand out a little card to classmates or classmates' families or parents, post it about it in class WhatsApp groups or community groups to gain popularity and to encourage families to utilize this. We talk about alternatives to candy like little erasers, squishies, stuffies, keychains, pens, pencils, all of that, of course, depending on the age, and just encouraging families to have that available so that it can be really inclusive for everybody.
Thanks. I think one of the other things that that covers all of these conditions is recognition and advocacy. So at any age, when a child has an illness or something that's chronic, you want to discuss it with them in an age-appropriate fashion for them to understand it. Because the best way for children of any age, and even adults, to adhere to any guidance or recommendations from their provider team is for them to understand what happens if. What are the consequences when? And for them to do that, they really need to understand it on their level. Sometimes we don't want to scare them, and that's okay. And there are ways to speak to children in a way that's not threatening, but for them to understand it, especially in the young children. But when it comes to our teens and older adolescents, they can be spoken to in a different manner where they really get the consequences of their actions and whether it could be potentially life-threatening or lead to more chronic, slow responsive reactions that can also lead to harm systemically. So any of these things are crucial to have that openness and conversation. And then advocate. So one of the things that Yael is mentioning is, talk to your community board, put it on your WhatsApp for your block, if that's what's happening. And there's small ways that kids can advocate for themselves, whether it be telling a teacher, I have this condition, or presenting it to the classroom about what's going on and why they need to have a safe space for X, Y, and Z. Sometimes it's just recognition and small things like that that really becomes a more inclusive, welcoming environment, and you have less pushback from the child because they see it as they're not necessarily being different. It's just something that makes them unique. I don't see any other questions. So with that, I'd like to thank everybody, our presenters, as well as our participants for today's webinar. I hope that we offered you an insight into how to address these things across all age groups and preparing for school. And please look forward to additional programming that we will have throughout the year. Thank you.